Hi, and welcome back to my channel. Today I'm going to talk more about the spinal cord stimulator. I did a video on my other page when I first got it done, and there's a few people that I still correspond to, and I want to do an update. It's been over a year. I apologize for the lighting. They say the best time to tape is in the morning, but I have a full-time job and a part-time job and a business. So it's kind of hard for me to get the exact lighting, and so it'll get better over time. So today I wanted to tell you a little bit about some of the success, or I don't want to say failures, but things that I've experienced in the last year from having the spinal cord stimulator. If you don't know, a spinal cord stimulator is a unit that they install in your back. I have a lead on either side of my spine, and what it does is it sends an electronic pulse to my spinal cord, and it blocks out pain. The reason why I got it is because I've had 2 failed back surgeries. I've had spinal fusions. I have a cadaver in my back. I have a cage in there. I've had a discectomy and a laminectomy, among some other things. I also have a degenerative joint disease, arthritis, fibromyalgia, and myofascial pain syndrome, and ankylosing spondylosis that affect my back. Now, when I got this unit, I did not think for a minute that it was going to take away that pain that was in my back. My purpose for getting this unit was actually to alleviate some of the pain that was going down my legs. It got to the point where sometimes I couldn't walk, I couldn't get out of bed, I couldn't move. So after I got this unit, my lower back, which was the most of my pain, and where of course is where your ankylosing spondylosis is, as well as some other issues that I've had, some bulging discs, are located. But I'd say I might got 15% reduction in pain from that. But for my legs, I've seen an increase of, I don't know, I would give it like 75% reduction in my pain. There's not many days I have where I can't put weight on my legs or I can't move. So for me, it's been a success. In my opinion, if it's something you want to do just for chronic back pain and you're not experiencing it where it's going down your legs, like mine was radiating to my toes. I couldn't put weight in. I would get out of bed and I would fall. This might be good for you, but from my experience when it comes to the back pain and the general pain, it really wasn't that successful for me. And again, everyone's results are different. I'm just speaking on my results. If I were to turn back time and have the surgery again, I would. I really would. It was worth it. It was very expensive, and I'm still paying for it, but it was worth it. With the spinal cord stimulator, I also have a battery pack that must be charged on a weekly basis, and I'm built small, so they couldn't put that in my back. It's actually in my ass, and you could feel it, and it's very noticeable. I don't like it at all. I swear that it hasn't fully healed. My dogs are fighting right now, so you might hear a little sound. I feel discomfort with it. As I mentioned before, I do have fibro with some other chronic pain issues, which is twisted, is my charger. And this is what I use to charge my butt. This goes in the area that you have to find your little hot spot for your battery to charge. And then, I think my battery's probably running low, but I don't know. This, make it a little closer, is, and it's a Medtronic 37751. And this is what I use to charge it. And it's letting me know that this is the location, this guy here. And then that's the currency. When I have it on my butt where I'm supposed to have it, I don't know if it'll be able to read it through my pants right now. But I hit that button. And I don't know if you can tell or not. But it'll let you know that it's trying to locate the area where your battery is so it can give it the most charge. And then, let's see. I'm nowhere near it because there's no boxes. So I'm going to hit that again. And again, it's just getting a reading of where my battery is located at. For it to charge. And that reads. And as you can see, I located exactly where it is. So right now, I'm being fully charged. And I actually need to charge because it's pretty low. And this here is my little handy dandy remote. I keep this in my purse. This part right here, I position it close to my battery pack to turn it on and off. This runs by batteries, and the unit that I showed you before is also battery operated. You can charge it like I can have one plugged in, charging while I'm charging this unit here, and this one takes a 2 AA batteries, I believe, because I buy those in bulk. And this will let me know if I'm close to my butt or not, which I'm not because I'm charging my other one. So I'm going to just put that over top of it. And it should be reading soon. And I can use this button here to turn my unit on or off. And it runs by the remote here. And this, if you can see the screen, will show how much current or pulse is going to it. Like right now I'm getting zapped. Now typically, and I'm going to turn this off, they say that you should use your unit 3 to 4 times a day for a few hours. And that's somewhere where I read it. I myself, I have chronic pain. I'm always in pain. My unit typically stays on almost 24/7. Whether that would be good for me or bad for me, I could work, I could function, I could move, and it's not killing me, and the doctors didn't tell me any differently. So for me, I keep it on unless I'm having a fantastic day, and I'll cut my unit off. Don't be like me and not charge all the time, because when this battery gets super low, it takes me hours. And when I say hours, like 3 to 4 hours to charge. So to keep that in consideration when you do have one of these units, it's important to keep it charged. And for this guy here that you keep in your purse or wherever, make sure you have extra AA batteries because you don't want that to die. And the unit that charges, you can also turn it on or off. The surgery itself took about 2 hours. They wake you up in the middle of the surgery to ask you how it feels, if it's positioned in the right way. I myself don't remember this. I remember them telling me before I had the surgery and when I came out of the surgery. Now, going back in the time before I had the surgery, I had what was called a trial, and I had the leads attached to me, and they were pretty much taped to my back to see if it worked or not. I had to do a psychological check through a therapist to conform me to see if it was something that I would be good for, because it's not a good fit for everyone. You're putting a foreign object in your body. Like the first time I took a shower, I was like, shit, I'm going to electrocute myself. The first time it rains, it's a little weird. It's like an internal TENS unit. It's a feeling like you're being electrocuted. It's something that some people I can see mentally can't handle because it's not like the TENS unit. Okay, enough of this and take it off. It's in your body. So do your research. Look at the pros and cons. Find a doctor who has had a history of doing them and contact their patients. I had a phenomenal doctor that I went to. I was going to Carolina Back Institute, which is located in Cary, North Carolina. And my surgeon was Dr. Margraf, who's absolutely amazing. And he's located on Six Forks Road in Raleigh, North Carolina. I highly suggest check out your doctor, research them, research the unit, because there's different units out there. Again, mine's Medtronic. I had a wonderful person signed to me, which you get, I don't know if there's like a salesperson or whatever, but you have a guy or girl assigned to you if you have any questions about your unit. I did have issues in the beginning. They had to reprogram my unit so for the first weekend that I did have it, I think I had it on a Tuesday or Wednesday, but I had to do a weekend without it. So I had like surgery pains plus that. Surgery pains did last a little while. It's just very uncomfortable, and then you feel that shit. They're skinny, but you feel it. So it is what it is. So if you have any questions, just put them down below. Or you can send me a message. I'll try my best to respond as promptly as I can. And I look forward to the next one. I think I might talk about one of my illnesses. I don't know if you missed this, but I have over 20 diagnoses. Fun me. I might do something on fibro or talk more, get some more information from my perspective. Thanks for spending time with me. Till next time.